Okay, good morning, Caroline. How are you doing?
I'm good. How are you?
Oh, not bad. We had a team away day yesterday, which was the first time that we'd all been together as a big group of 20 odd people for the first time in 2 years. So I'm still basking in the glow of meeting colleagues again and actually meeting some colleagues I'd never seen that have joined us since March 2020. So
Yeah, it's
really good.
it makes a huge difference, doesn't it, being able to speak to people in person?
Yeah, and there's always the debate. You kind of feel like you know some people so well, and you're going, "Have we met in person or
I know,
not?" You know.
I know, yeah, I know. When you
So,
only recognise them from the neck up.
exactly. So, yeah. Today we've got, as I said last week, quite a few questions to get through. Although hopefully we'll make some good progress with that today. What I've done is tried to categorise them into um, questions that are not related to pay, terms and conditions, and pensions, which would fall loosely under Tom Power's remit. And I think we agreed just before we started recording that we would try and do one of those by next week that addresses all of those questions. And then today I've taken the questions that don't fall under that theme, and we'll ask you those today. Is there anything you want to speak about before we start, or will I just nip on with the questions?
No, I think obviously I would imagine and anticipate increasing numbers of questions around T's and C's and pay and conditions because it is really important. And as the cost of living increases, and I just saw the inflation news this morning, which is now over 10%. This isn't going to get any easier in regards to balancing cost of living with our earnings, and clearly there's lots going on around that just now. So I think doing a focus session with Tom would be the best way to do that. And as I say, we'll try and get that done next week.
Okay, and just while I remember, we did do a little bit more of a detailed update in last week's brief following the Q&A with a bit more information for staff to give background and context. If there's any feedback on that or anybody thinks we need to provide more detail still or it was too much, feel free to let us know and we can take that on board. Um, but at the moment, we'll keep trying to do that as best as we can. So, in the meantime, I will start with the first question, which comes from an anonymous colleague in Cornhill. Um, they would like to know if there are any firm plans to incorporate a more inclusive, patient centred, and importantly, interdisciplinary approach to the way we care for patients in all of our services, but especially at Cornhill Hospital. The colleague mentioned she'd like to see a lot more emphasis placed upon helping patients be more included in their care plans, especially things that help build skills around personal resilience, adapting to and coping with illnesses, and generally just gives people more control themselves. Is that something you want to comment on, Caroline?
Yeah, I mean that's absolutely what we should be doing just now. So person centered care has been around for a long time, and absolutely, I think everyone, and most importantly, patients and their families. That is exactly what people want to see, and patients and colleagues that are receiving care in Royal Cornhill Hospital or delivering care are no different. Clearly, it will take a different approach, but absolutely. And if there are ideas or suggestions that you have about how how to do that differently, and if you're not feeling that you're doing it well enough, then you will get huge support from that from multidisciplinary teams. And so I would strongly advocate that you continue to do what you're doing, and if there's room for improvement. Now, Royal Cornhill, if I understand it, and our mental health services are one of the sites that are moving forward for magnet designation. So that is all about how we care for patients. and the outcomes that are achieved, including their experience and how much they feel they participate in care. So if you've got any questions around that, speak to your nurse manager or any of the team in practice development, and they will be able to help you with that. But yeah, that is absolutely what you are pushing at an open door.
Okay, thank you, Caroline. The next one's a collective question from the staff and students at Aberdeen Dental Hospital. They've said that the Aroma Cafe at the dental hospital closed a few months ago at very short notice, and they've been left with no form of catering or vending in the immediate area that staff can access easily or realistically in the limited time they have available. Excuse me. And they go on to say that, they have a lovely award-winning building, but it's full of glass. The windows are designed not to open, and the temperatures, especially in the recent heat wave, have been very, very high. They mentioned PPE, wearing that in hot temperatures, and the impact of not having access to things like drinking water is really difficult. They've also heard that estates might be removing the plumbed-in water coolers, which would leave them only with 2 drinking water taps in the building. They've asked if you're aware of that situation and if there are any plans in place to resolve that.
So thanks for the question, and I am aware of the challenges around all of our catering facilities, and we've had a lot of conversations in the Q&A around that. So I know that Chantal and Eleanor, who is head of catering, and Chantal works in Paul Allen's team, are now leading a piece of work around what catering of the future needs to look like, that is viable and sustainable, and meets the needs of those that use it. So that is a definite piece of work. I can't imagine that the dental hospital are not part of that, and that would include therefore the Aroma Cafe. But what we will do is we'll absolutely confirm that with Chantal, and we can just put a comment around that. You then spoke about the beautiful building that you have, but actually the challenges that presents because it's glass and the windows don't open. And that is one of the challenges of those buildings. And for us, and indeed, I would imagine across the UK, as temperatures increase more frequently, that is going to become an increasing challenge for us. So clearly, all learning from current builds into new designs is part of the work that we are doing in anything new that we're building. However, it is really important that we can do everything we can to ensure working conditions are safe. So access to drinking water is really, really important. And again, Chantal and colleagues have worked through a number of areas. You're not alone in the extreme heat that you experience. There are other areas across Grampian where that is a real issue, not just in clinical areas, but in some buildings that we have. So I am very thoughtful of how we know where those sites are, how we do everything possible to maintain an appropriate temperature, and the minimum we should be doing is providing access to drinking water. Paul Allen and I have had a number of conversations around drinking water, around plumbed in water coolers, around bottled water. And what we are absolutely trying to do is find a way forward that is not going to impact negatively environmentally, and that meets the standards of infection control. I have no information that I didn't know you had 2 plumbed in water coolers, but I have no knowledge or understanding that they are being removed. Again, we can confirm that via Chantal, and work with you to understand what your environment and the temperature control, what the kind of optimum things are that we can be doing to support you with that. It is really important and when you add PPE on top of that, you're absolutely right. It's incredibly difficult to remain effective when you're not working in a temperature that's safe or tolerable. So I don't have much detail around the dental hospital. So as I say, thanks for the question, and I'll get Chantal to reach out to whoever sent the question and work things through with you.
Okay, thank you, Caroline. The next one's again anonymous. It's regarding expenses. The colleague mentions that the expenses, when we claim them, are added to our pay slips as part of our pay, which means that we are then charged tax and have deductions such as national insurance, etc., taken from these expenses. He says that it seems unfair to be effectively paying tax twice on things such as petrol and training courses when we're buying them with money that's already been taxed when we were paid. Would you have any thoughts or comments on that, Caroline?
So that is indeed my understanding. However, what I would suggest we do is we just bump that into Tom's so that we can absolutely be clear on the facts around that. But yeah, that is my understanding. The fairness of UK tax law, I think, is beyond my sphere of influence. But let's get the facts from Tom. So we'll get him so that he can have a definitive answer for that next week.
Okay, thank you. The next one's anonymous, but on behalf of 5 Open University students at Dr. Gray's Hospital. They say there are a number of OU students coming up for their final exam in September. Many have already found jobs within the organisation, but they find it frustrating that they are working at a band 3 level until they qualify. We have worked and studied so hard through the last 4 years and a pandemic, with only one exam left before passing our nursing degree with honours. Is there any scope to move us up to band 4 until our registration comes
in? Okay. I thought we'd already done that, if I'm honest. So I thought, or perhaps that's when, so this must be when they are working on the bank potentially, as opposed to working as students. So what I'll need to get June, the nurse director, June Brown, to confirm that for me. But what absolutely will be the case, there will be no distinction between colleagues who are doing their honours degree programme on OU or at any other university. So whatever you're experiencing will be the same as other students. But I do understand your frustration, because of course your colleagues who graduated without an honours degree will be earning a band 5 salary now. So I understand your frustration. I think there is it's a valid question, and I'll get June to confirm where we're at with that. And I think, Mike, you've got their details, so we can go back quite quickly to these colleagues.
Yes, I can. Okay. The next question comes from Emma McMillan, who is a health visitor. She mentions that she's concerned about the safety and efficacy of COVID-19 vaccines. She says she's read a lot of research online, and she wonders why NHS Grampian are happy to offer these to children. Is there anything you can address about that, Caroline?
Absolutely, Emma. I think this is quite a serious issue that you're raising that with me. It is absolutely imperative that as professionals you feel confident and fully equipped with the evidence base to do what you are doing, to give you the confidence and for you to work within your regulatory framework. But if that's how you feel, how is that giving confidence to parents? Excuse me, I'm just receiving a Teams call. Sorry. So
right.
I somehow managed to answer that Teams call there, and they're phoning back. So Emma, yeah, I mean, it's imperative that you give confidence to parents and children that are receiving these vaccines. And if you don't understand the evidence base or don't have confidence in that, then that is a real concern. So my suggestion is that rapidly we get support, professional support around you, and make sure that the research that you're reading online, which um, is variable and actually often not validated research, is you're supported with the evidence that has underpinned the decision making of JCVI and the myriad of professionals that have endorsed these vaccines for children. So what I'm going to do straight after this call, Emma, is ensure that we get in touch with you to make sure you are supported to answer your questions and work that through professionally.
Okay, thanks, Caroline. The next one is anonymous as well. Not as well, it's an anonymous one. What is the guidance on Teams face-to-face meetings? This person mentions that their team of a group of 16 are all based in different areas of ARI, but they would prefer to meet face to face regularly rather than have the Teams calls that they've been having up until now. Are you aware of the guidance just now, Caroline?
So I'm not absolutely up to speed with the most current guidance, so I might get this wrong. A kind of, however, at a generic level, it is absolutely acceptable for teams now to prioritise and make the time and space to meet together safely. Is my understanding. In fact, Mike, you spoke about your team getting together at the beginning of this conversation. So from my perspective, physical contact and getting together as a team is really, really important. I think we all have to think about how do we do that in the physical space that we've got, and how do we make sure that we do it as safely as possible to ensure we don't wipe an entire team out. COVID is still very present, and will continue to return. So how do we do that safely? How do we plan it? And I don't think we should be reverting back to everything in person, because one, we don't have the right accommodation for that, and actually the future is absolutely about hybrid working in different ways. And certainly in the team that I'm part of, colleagues from across Grampian can come together much more easily by teams. But I think plan it well, do it as safely as you possibly can, and thoroughly enjoy it, because it's really important.
And it's one of those, I'll put something on screen just to clarify the position before this comes out,
Okay.
because it's understandable. It's changed so much that a lot of us are a little bit uncertain. So the next question is from an anonymous nursing colleague who asks why we are still so extensively using face masks in clinical settings, and if there is a plan to stop using face masks in clinical settings in the future. I assumed that was in situations where we wouldn't have done prior to March 2020.
Yeah. So I think it's a really live conversation just now in regards to what can we do to make the working conditions and environment for colleagues the best it possibly can be. However, at the moment, I don't believe there are any conversations about removing face masks in healthcare settings, and that is predominantly based on the evidence base relating to the spread of infection. So we're guided by that nationally, and there is nothing in the pipeline about removing that. And I know that makes things challenging. Just for information, because we had a question in a different setting, I can't remember, where people were talking about how that inhibits communication, particularly with those with a cognitive impairment. And June Brown is very clear that we should be able to order clear face masks in those circumstances, and that's not for everyone, obviously, but yeah, I empathise and I recognise it's incredibly inhibiting sometimes and uncomfortable wearing face masks all the time. But at the moment, there's no plan to remove that.
Okay, thank you. The next one is, I don't know how you'll react to this one. I haven't mentioned it to you before we started recording. It's an anonymous colleague who has asked if you would consider doing a Q&A live online or in person in the future. I don't know how you feel about that.
Yeah. I mean, that was always the intention. And then so I would much rather be doing this in person, because then at least I can see people's faces when I'm answering the question. So yeah, so to help with that and be a bit broader, absolutely. I'm working for over the coming months, working with Mike and colleagues in the comms team as well as the executive team about how can we do more to reduce the so remember from the Best Practice Australia survey, the Culture Matters work, and what we're trying to do is to be aware of and resolve problems when they're at their earliest stage. So the problem pipeline is how that's referred to. So lots of options. If you have any good ideas about how we could do that, because I think we've tried Facebook Live before. Happy to have a larger event. As much as it's uncomfortable sometimes, it's absolutely the right thing to do. So yeah, get back in touch with Mike and give him your ideas.
Okie dokie, thank you. The next one is from somebody else who'd watched one of the Q&A sessions. It was the one with Paul Allen, and the discussion that you had around unused laptops and how do we get them back into the system. This person has asked, they've said historically there have been programs to upgrade older laptops. And they've mentioned that within their team there are a number of these sitting around because they're generally not fit for purpose anymore. They still work, but they're just not capable of working to the level that staff need them to. They mentioned that these would absolutely be used to help staff work at home if they were up to the standard. They've spoken to IT, but because they're not broken and in need of repair, essentially, they won't support replacement of these. So I guess the original question was, do you know if there's any program that's going to be rolled out to upgrade these types of laptops? Is that one that maybe we need to ask Paul for his thoughts on?
I don't know. What I do know is that we're trying to so thinking about sustainability. So reuse would be our next step if something's not being utilised, and so I think the shortest answer to that is let's ask Paul Allen. And he'll be able to answer that straight away, and we can put a wee thing in the brief, hopefully.
Okay, I'll just skip down my list because I suspect there's another one here that Paul
I'm trying to write the list as well. Just for people that are watching this, Mike and I have to write down all these questions and then go and find the answers between us. So yeah, hopefully we don't miss them.
Yeah. Okay, so this one's from an anonymous PA colleague. They would like to ask if there's any way that we could stop Teams automatically opening up every time we log into a computer. It seems to do this automatically on every computer, but it obviously starts using up the resources, increases the load times. They've spoken to IT, and apparently it can be resolved if you ask, but it doesn't make sense to do this for every computer in a department and provide NHSG asset numbers. they've asked if it's something that could be looked at. So I suspect that's probably one for Paul as well.
We need to ask. I'm the last person you would want to answer that question. I mean, I suppose so. They must be talking about a kind of generic computer used by multiple people, because when Teams comes on for an individual user, it is literally within a second. You can just close it down. So it must be, that must be what it is. So I think if we can understand if there's a technical solution to that, or indeed if it is a wider problem. So I'll put that into, let's ask Paul.
Okay. The next one is from an anonymous member of staff at Wood End. They mentioned that the Wood End staff gym was closed due to COVID-19, understandably. And obviously with a return to some form of normality, they've asked when the gym is going to reopen. They mention again the positive impact this has for staff at work on well-being and physical health. I know we were previously asked about the ARI staff gym, which is one, yeah. We tried to follow up on that one, and it was a lot more difficult than we thought it would be. I think in ARI, the space had been used for clinical things during COVID, and it didn't make sense to move that again. So the issue there seemed to be identifying a new space. I'm not sure about Wood End, but again, that's maybe one we need to try and get some clarity on, unless you're aware of anything, Caroline.
No, I'm absolutely not aware of anything around the Wood End gym. I know that I just actually yesterday asked Tom for an update on the ARI gym, and where were we with plans for that, because obviously the health and well-being of colleagues is a core part of the improvements that we are making. So we will need to. I don't know about the Wood End gym, so let's find out, and we can go back. Is that an anonymous one, or do you know who that? You'll know who that's from? So we can put something into the brief, but probably go back to the colleague via yourself then, Mike, to see if they're happy to have a conversation about specifically the Wood End gym.
Okay, thank you. The next one's from an anonymous consultant colleague this time, who says they understand that lease car applications were suspended during COVID, which made sense. However, again, following a return to more like normality, we are still struggling to find out who would authorise car lease applications for eligible medical staff. They've asked if you know, Caroline, whether this is still on hold or if you can point them in the right direction with that one.
Yeah, so I've never leased a car, so I'm not aware of our policy position. I would imagine it sits between our somebody in Tom's team and your line manager. So again, what we'll do is get clarity on, firstly, is the suspension of lease cars still in place? And if it is, why is that, and when is it going to be lifted? And then, although this colleague is anonymous, the email will have come to you, Mike, so you can go back to them. I'll give you I'll get the specific contact for them, and then we'll put something more generic in the brief around perhaps how do you go about getting a car lease approved. But we'll go back specifically to this colleague so we can do that as quickly as possible.
Okay, the next one's anonymous again. It's from a colleague in Murray who says, as part of their position, they order a variety of items through PECOS. But as PECOS doesn't supply pictures of the items and you only really get basic information, often you end up with an inappropriate or a wrong item that doesn't quite work for what you wanted it to do. Unfortunately, a lot of the time procurement can't take the item back, so you end up with excess unused items in the department. They then go on to ask if that's something that we could look at in terms of small pictures of the items on PECOS, but they also suggest that whether there's something that could be set up on the intranet where departments who have spare items could be put up and listed and shared with any other departments that may get use of them. Is that something you'd want to comment on, Caroline?
Yeah, so both points seem really practical, don't they? And actually, it doesn't seem
Yeah.
in our world of sustainability and having people order things because they don't quite know what they're ordering and then not being able to put them back and sitting with them just does not make sense. So I don't know if there is a function that allows you to see a picture of something, and if there is, we can confirm that. If there's not, I think Paul Allen's going to love me after this Q&A. We need to ask Paul if that's technically feasible and if we're able to do that, because that just seems like a contemporary way to be able to make sure you are getting the right stuff. As far as the kind of reuse piece, I'm not aware of that, but again, that seems very practical. I don't know if I've not used that. I don't know if you've had any
Yeah.
experience of that.
Well, yeah, there is actually something, and I'll put a link to it on screen so that people are aware of it. I'm never sure if it's called Warp It or Warp IT. I'm not sure, but I'll put the link on the screen. But
Hopefully not
essentially, what
warped
that
IT.
allows people to do, indeed, it allows people to advertise unused items exactly as the person said. I think it's office equipment, furniture, and I think IT. But that works across NHSG as well as the councils, so it's quite extensive actually. So yeah, we'll flag that for people's awareness. But yeah, it's a really good suggestion and critical in terms of sustainability as well, I think. So okie dokie. The next one is again it's related to PECOS at least. This is from an anonymous nursing colleague, again in Murray, who has asked if there's anything that can be done organisation wide to improve access to endowment money / funds. They say they've often wanted to use the endowment fund for patient activities. However, as the items they need aren't available on PECOS, we've been unable to buy them through endowments. They give a couple of examples. In their ward, they wanted to have a pizza night for patients, which obviously wasn't something that could be done through PECOS. Another example was just simple props for patient activities that came from various online shops that they couldn't get through endowments. Is there anything you can say about that, Caroline?
So I had a great conversation recently with Lisa, who is the new the new lead for our NHS endowments or NHS charities, and Lisa is really, really focused on making sure that endowment funds are accessible to improve colleague and patient experience. So there are really tight rules around, and quite rightly, governance around endowments. However, I think Lisa is the best person for you to speak to, and she will help you understand what's possible, how to make that possible, and what you need to do. So let's just put Lisa and this colleague in direct contact, Mike, and they can work through what's possible. And I do know, however, that Lisa's really keen to make the accessibility and the understanding of these funds much more straightforward. So there's maybe something in the future that we can put in the brief around that. I think they've already put stuff in the brief, but there's maybe a bit more we could do.
Okay, I'm just looking through my list, and I think in record time we've got through 15 questions, so that's
There you go.
really cool. Indeed. I know there were quite a lot of questions. We're going to have to get back to people on there, but as Caroline said, I think she's quite happy to be a point of contact for people and point people in the right direction and things. So keep your questions coming. I think we're nearly caught up with the outstanding ones, except those relating to Tom Power and the People and Culture Directorate, which we'll try and do in the next week or so. Is there anything you'd want to add just before we finish, Caroline?
Uh, so my only kind of thing that I was thoughtful of as we were progressing through there was, so the colleague that got in touch with you about doing a live Q&A, and you and I have been trying to work through how do we do that. Why, if they're up for it, why don't we do that with their help to whatever kind of part of the system they're in, or whichever community of colleagues they're part of, work with them to see how that could possibly work is an offer or a suggestion, and we can start to test how we can do these in person or in a different way. Because you and I have made a commitment that I'm sure this will have its lifespan, and we need to keep moving things forward. So let's stay true to that, but we are going to do it. So if somebody's already said they're quite interested in that, we might as well try and work with them.
Yeah, that sounds like a good idea. It'll be slightly nerve-wracking, as you said, but we'll be up for it and we'll try and make it work. The only issue might be capturing it so it's available to
So we can
wider
share.
staff.
Yeah.
Yeah, but we can work through those, and if we have to do it in different areas, that's fine too. Okay then, thank you very much, Caroline, and I will see you next week for our session with Tom.
No problem. Have a good week. See you
Cheerio,
later.
bye.
Bye.